Nature works in cycles. Within these cycles are a series of changes. Nature has a sort of language of its own that reveals these changes. Similarly, a woman's body has its own language. It communicates with her about fertility every day throughout her reproductive years. Naturally occurring signs experienced by nearly all women have been recognized, studied, and characterized. As a result of this research, it's possible for a woman to interpret this new language and to develop a day-to-day awareness of her fertility and infertility. This concept is the basis of natural family planning. Unlike the now obsolete rhythm method, which relied on a woman's past menstrual cycles to determine fertile days within future cycles, natural family planning uses contemporary, biologically valid methods to monitor a woman's naturally occurring body messages. Dr. Joseph Kincaid, endocrinologist.
If you realize that natural family planning has a 98+ effectiveness, making it just as effective as any of the artificial means of birth control, then I think every couple really should be entitled to know about natural family planning.
The most frequent reasons individuals seek information about natural family planning is to help in limiting, spacing, or achieving pregnancy, because of their dissatisfaction with other family planning methods, because of medical conditions or religious beliefs, or simply an interest in learning about a woman's natural fertility and infertility. Natural family planning, often referred to as NFP, incorporates several natural methods.
What we're presenting tonight, what we call natural family planning, incorporates both basal body temperature and ovulation.
Before we discuss these methods, a basic understanding of fertility and the male and female reproductive systems is necessary. Both lay a sound scientific foundation for the fundamental concepts of NFP. From puberty on, the male is considered to be always fertile. That is, he is continuously producing viable sperm. It is possible, however, that sperm may be low in number or abnormal in shape or motion, factors that could affect overall fertility. But in the application of NFP concepts and guidelines, the male is assumed to be fertile on a continuous basis. On the other hand, the female experiences cyclic fertility. Influenced by several important naturally occurring hormones, she experiences both fertile times, when she has the potential to conceive, and infertile times, when conditions are not conducive to conception. These fertile and infertile times surround the key event in a woman's fertility cycle, ovulation. Ovulation is the release of a mature egg from a woman's ovaries. If the egg is fertilized by sperm during this time, then conception occurs. If there is no fertilization, then menstruation will occur. This main event, ovulation, separates a woman's cycle into two phases: the pre-ovulatory, or before ovulation, which includes menstruation, and the post-ovulatory, after ovulation. The pre-ovulatory phase begins with the first day of menstruation and lasts until ovulation. During this time, the hormone estrogen is building up, causing a special kind of mucus, cervical mucus, to develop and change in quantity and quality. This mucus appears in the vaginal area. It is the sign that signals the beginning of a woman's fertile time. Sperm can survive in this mucus for several days. After ovulation has occurred, the post-ovulatory phase begins and lasts until the day before menstruation. During this time, the hormone progesterone is secreted and begins changing the cervical mucus from signs of fertility to signs of infertility. Observing cervical mucus is an NFP method known as the ovulation method. The ovulation method was pioneered by two Australian physicians, Doctors John and Evelyn Billings. The Billings' thorough research into this natural course of events in a woman's cycle is the basis for the ovulation method. Dr. Evelyn Billings explains their method.
It's important to understand that a woman is fertile for only a short time in every cycle, and that is associated with the event of ovulation, and there's only one day in any cycle when ovulation occurs. Now, just a few days prior to ovulation, on average of 6 days, the neck of the uterus secretes a special secretion which is called cervical mucus, which is a very lubricative, wet secretion which leaves the body very quickly. And the woman can appreciate that secretion is present outside the body. Now, this gives her very positive evidence that she is approaching ovulation and therefore that she is in a highly fertile state. So before that occurs, she knows she's infertile, and after it's all over, then she knows she's infertile. And with that information, then the husband and wife can make decisions as to whether they'll have a child or avoid conception.
The other natural family planning method is called the basal body temperature method. The basal body temperature is the temperature of the human body at rest, unaffected by activity, food, or drink. During the pre-ovulatory phase, when a woman is fertile, the basal body temperature is low. After ovulation, during the post-ovulatory phase, the basal body temperature rises. This shift in the basal body temperature can only accurately be monitored with a special thermometer. This method can only indicate the infertile time after ovulation and therefore is often used in combination with the ovulation method. These are two natural methods that can be effective in interpreting a woman's body language. This language, however, is unique to each woman's cycle, and trained instructors using natural family planning methods can teach individuals how to interpret their body's signs. Classes are available which include basic male and female reproductive anatomy and physiology, instruction in the ovulation method, the basal body temperature method, and how to combine these two natural methods for a more complete picture of fertility. Natural family planning provides an effectiveness rate in avoiding pregnancy which equals those of other temporary methods of birth control. It is important to point out that, with the exception of total abstinence, no method is 100% effective and is only as reliable as its user. Natural family planning can also be used to space pregnancies, because it is an excellent way to determine the optimum time for pregnancy to occur. NFP is a method which any woman can use, whether she considers her menstrual cycles to be regular or irregular. It can also be used in any circumstance throughout a woman's reproductive life, after childbirth, while breastfeeding, following hormone therapy, or premenopause. Natural family planning is a shared method. Working together, the couple understands and appreciates the female fertility cycle. This knowledge and appreciation helps many couples to experience more open communication, leading to a deeper sense of intimacy within their relationship. NFP is free of harmful side effects because the methods rely totally upon naturally occurring signs and involve no use of drugs, chemicals, or mechanical barriers. Natural family planning, an inexpensive way for a woman to develop a day-to-day awareness of her body and fertility cycle, to understand her body language.
It is effective. I think that maybe in the beginning we were a little bit skeptical, but at our class we were told this is something that when you go home and you use this method, you'll see for yourself. You see your body signs, you know you're actually administering the method to yourself. You know, I do it, I know, I see what's happening. And that way, I feel confident that the method is working.